Dr. Thomas Seyfried discusses his view that cancer is fundamentally a metabolic disease rather than a genetic disease as is commonly believed. He explains that while genetic mutations are present in cancer cells, these mutations are downstream effects of damage to the cell's mitochondria and energy metabolism. Seyfried argues that the root cause of cancer is dysfunction of cellular energy production, specifically in the mitochondria. He describes how normal cells are forced to switch from efficient energy production through respiration to a more primitive form of energy production called fermentation. This metabolic shift leads to uncontrolled cell growth. Seyfried contends that the cancer field has been overly focused on genetic mutations while overlooking the underlying metabolic issues driving cancer growth. Seyfried discusses Otto Warburg's work from the early 20th century, showing that cancer cells rely heavily on fermentation of glucose for energy, even in the presence of oxygen. This is known as the Warburg effect. He explains that as mitochondria become dysfunctional, they produce reactive oxygen species that damage cellular components, including DNA. This leads to the mutations seen in cancer cells. According to Seyfried, the key question is what fuel is driving the dysregulated growth of cancer cells. He argues that glucose and glutamine are the primary fermentable fuels that cancer cells depend on. By restricting these fuels while providing alternative fuels like ketone bodies that cancer cells cannot effectively use, it may be possible to starve cancer cells while supporting normal cells. Seyfried outlines his press-pulse approach to targeting cancer metabolism. The press involves sustained restriction of glucose and glutamine to stress cancer cells. The pulse involves short-term treatments to further disrupt cancer cell metabolism, such as hyperbaric oxygen therapy or specific drugs. He emphasizes that this metabolic approach allows for lower, less toxic doses of cancer drugs to be effective when combined with dietary manipulation. He contrasts this with standard treatments like radiation and chemotherapy, which he argues can actually fuel cancer growth by increasing glucose and glutamine availability to tumor cells. Seyfried expresses frustration that the metabolic approach is not more widely adopted despite the evidence supporting its potential. Seyfried discusses the history and rationale for using ketogenic diets in cancer treatment. He explains how ketogenic diets can lower blood glucose and elevate ketone bodies, creating a metabolic state that is stressful for cancer cells but supportive of normal cells. He notes that simply doing a ketogenic diet is not enough. Blood glucose and ketone levels must be carefully monitored and managed to achieve a therapeutic effect. He emphasizes that the ketogenic diet is just one part of a comprehensive metabolic therapy approach. Other aspects include targeting glutamine metabolism, managing stress, and potentially incorporating hyperbaric oxygen therapy. Seyfried argues this metabolic approach could be effective for many cancer types, but particularly for aggressive cancers like glioblastoma. Seyfried discusses some of the challenges in researching and implementing metabolic therapies for cancer. He notes that proper clinical trials are difficult because the approach needs to be personalized for each patient based on their individual metabolic profile. Additionally, institutional review boards often will not approve trials that don't include the standard of care treatments. He expresses frustration that major cancer centers continue to use treatments like radiation that he believes are counterproductive, fueling cancer growth through increased glucose and glutamine availability. Seyfried argues there is a lack of understanding of cancer metabolism among many oncologists and cancer researchers. While large clinical trials are lacking, Seyfried discusses the accumulating evidence from case studies and animal research supporting the metabolic approach. He and his colleagues have published case reports of patients responding well to metabolic therapies, often in combination with lower doses of standard treatments. He argues that this growing body of evidence, combined with the clear scientific rationale, should be enough to drive further research and clinical adoption of metabolic therapies. Seyfried emphasizes that the metabolic approach is not about curing cancer overnight, but about managing it as a chronic condition by continually stressing cancer metabolism while supporting overall health. He believes this could lead to better long-term outcomes with less toxicity than standard approaches. The conversation touches on how the metabolic perspective on cancer has implications for overall health and disease prevention. Seyfried discusses how the same metabolic therapies being explored for cancer could have benefits for other conditions, particularly neurological disorders. He notes the long history of using ketogenic diets for epilepsy as an example. The discussion highlights how focusing on metabolic health through diet, stress reduction, and other lifestyle factors could potentially reduce cancer risk and improve overall health outcomes. Seyfried argues for a shift in healthcare towards a more preventative, metabolism-focused approach. Seyfried acknowledges that his views are controversial within the cancer research field. He discusses some of the pushback he has received and the reasons why the metabolic perspective has not been more widely adopted. These include entrenched beliefs about cancer being primarily a genetic disease, financial interests in existing treatment approaches, and a lack of understanding of cancer metabolism among many researchers and clinicians. He expresses frustration with what he sees as a resistance to new ideas and evidence within the cancer research establishment. Seyfried argues that the consistent poor outcomes for many cancer types using standard approaches should drive more openness to alternative strategies like metabolic therapies. Despite the challenges, Seyfried expresses optimism about the future of metabolic therapies for cancer. He discusses ongoing research and clinical work exploring these approaches, including efforts to develop more standardized protocols that could be implemented more widely. He believes that as more evidence accumulates and more clinicians gain experience with metabolic therapies, adoption will increase. Seyfried emphasizes that the metabolic approach offers hope for better outcomes with less toxicity, particularly for aggressive cancers that respond poorly to standard treatments. He envisions a future where cancer is managed as a chronic metabolic condition, with patients maintaining metabolic health long-term to prevent recurrence and progression. While emphasizing that patients should work with their doctors, Seyfried offers some general advice for those interested in metabolic approaches to cancer. He stresses the importance of carefully monitoring blood glucose and ketone levels rather than simply following a particular diet. He recommends working with clinicians experienced in metabolic therapies who can properly implement and adjust the approach. Seyfried also discusses the importance of stress reduction, as stress hormones can drive up blood glucose. He suggests mind-body practices and other stress management techniques as part of a comprehensive approach. He cautions against extreme fasting or other drastic measures without proper medical supervision. Dr. Seyfried concludes by reiterating his belief that cancer is fundamentally a metabolic disease and that addressing the underlying metabolic issues offers the best hope for improving outcomes. He expresses both frustration at the slow pace of change in cancer treatment and optimism that metabolic therapies will eventually become a mainstream approach. Seyfried emphasizes that while there is still much to learn, enough is already known about cancer metabolism to justify wider adoption of metabolic therapies. He encourages patients and clinicians to educate themselves about these approaches and to push for more research and clinical implementation. Ultimately, he believes that viewing cancer through a metabolic lens opens up new possibilities for prevention, treatment, and long-term management of the disease.